Hello, my name is Dan White. I'm a physical therapist and associate professor at the University of Delaware, and it's my pleasure to give this video abstract for an article I had the pleasure of writing with my co-authors entitled Stepping Forward, a Scoping Review of Physical Activity in Osteoarthritis. So with the help of my Chihuahua, Oliver, we are going to answer a couple questions that are raised in our article to give you an overview of what the article covers. So the first question is, what is physical activity? And technically, physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure. And a bonus question is how does that differ than exercise? And exercise is any physical activity that is planned, structures, and repetitive. So for instance, if you're going to go to the grocery store and then go to the gym, the first part, the grocery store, is not exercise, but it does count as physical activity. But going to the gym and doing weight training would count as exercise because that is planned, repetitive, and structured. So the next question is, how is physical activity measured? And physical activity can be measured from questionnaires or patient-reported outcomes or wearable monitors. Typically, these monitors could be something as simple as a step counter that could be found in your iPhone or cellular phone, or it could be a research-grade monitor that can go around your waist or around your wrist or be attached to your thigh. What are common metrics of physical activity? We typically use steps per day, or how many steps you take within waking hours to measure physical activity. That is a very practical and tangible way to quantify your daily activity. Other metrics include the time spent in light, moderate, and vigorous intensities of physical activity. Why is physical activity important for osteoarthritis? Studies show that exercise, especially when combined with diet, has positive outcomes for pain and physical function in people with osteoarthritis. And this builds on studies that show just for the general population that having a physically active lifestyle is associated with a lot of positive health outcomes, such as reduced risk of mortality, lower risk of diabetes, lower risk of obesity, and just overall improved mood. I've added another dog, our second dog, Theo, and we're going to answer this last question together. What is the relation of physical activity with the development of knee OA? And basically, there is no association with physical activity with the development of OA. There are some studies that indicate high levels of physical activity are associated with structural damage of the knee, but by and large, there is no association with recreational physical activity or exercise with the development of knee OA. The last item discussed in our paper is what is not known in physical activity in osteoarthritis. The first area is we are unsure how to increase physical activity or have specific interventions that increase physical activity in this patient population. Certainly some are being developed, but this is certainly an area of need. And the second thing that kind of bubbles to the top of this long list of what's not known is how physical activity might change with current interventions we use, specifically intra-articular injections and exercise interventions. There's some interesting work out of La Trobe University, specifically from Emily Bell, who is starting to look at this specifically with exercise therapy, but there certainly needs to be more research investigating how physical activity might change given the current interventions that we give this patient population. Thank you for listening to this video abstract with Oliver and I. I hope you enjoyed it. Just to conclude, physical activity is certainly an important health outcome for osteoarthritis, and the measurement of physical activity has evolved to be quite feasible for consumers and for researchers. I think there's a lot that we know, specifically with the strong relationship between physical activity and health outcomes, both specific to OA and for health in general. But there's still a lot more that we need to know in this area of research. Thanks so much.